My name is Dr. Elana Clar, and I'm a neurologist. I grew up working alongside my mom, who was a nurse at elderly care facilities, and I simply love spending time with residents and their families, so it felt very natural to go into medicine. No two patients are alike, and over the years I've had exposure to a wide breadth of patients with different forms of Parkinsonism, genetic forms of dystonia, and complicated tremors, many of which required unique medical and surgical treatment options. The scope of research in movement disorders is expanding every day and changing the landscape about how we diagnose and treat disorders. And for that reason, I'm incredibly excited to be in this field, in this subspecialty. I think patients are fascinating. Everything from learning their life history to the reason they came to see you that day in the office. I genuinely enjoy listening to my patients and hearing their stories. One of the cases that resonated the most with me was a gentleman who had to be put on disability because he was unable to work and he had so many side effects from his medications, and he had not yet broached the idea of pursuing deep brain stimulation surgery. And we were able, over the course of several months, we were able to change his medical management and get him teed up for surgical intervention. And after the procedure, I mean, he looked like a completely new man, and he had a whole new quality of life. He was able to go back to work. He was more engaged with his family. He was able to go on vacations again. So when you hear those kinds of stories, when you see those kinds of stories, when you are involved in those kinds of journeys, I think it really validates why you do what you do, and it just makes you feel really good about it.